What is cervical cancer? The cervix is the lower part of your uterus, womb. Cancer of the cervix, cervical cancer, is a serious but preventable disease. Screening tests can find changes in cervical cells before cancer develops. Changes in cervical cells before cancer develops are called dysplasia. Removing cells that have dysplasia can prevent cervical cancer. If left untreated, dysplasia can lead to cervical cancer. Screening tests can help prevent cervical cancer. Cervical cancer can be cured if it's found at an early stage. What causes cervical cancer? Cervical cancer is caused by a virus called human papillomavirus, HPV. HPV is not the same as human immunodeficiency virus, HIV, which causes AIDS, or herpes simplex virus, HSV, which causes cold sores and genital herpes. Infection with HPV is very common among adults in the United States. In fact, most people will have HPV at some point in their lives. Usually, your body's immune system fights off the infection, and HPV goes away on its own. Talking with your partner about HPV. Finding out you have HPV can be disturbing. You may be concerned that your partner was unfaithful. Your partner may think that you were. It's really important to make sure you both have the facts about HPV. Most adults have HPV at some time during their lives. HPV doesn't cause symptoms and usually goes away on its own. Most people with HPV don't know they have it. Usually it is impossible to know which partner gave a person HPV. HPV is not a sign that you or your partner was unfaithful. It is not helpful or fair to blame your partner if you have HPV. Having an open conversation with your partner about HPV is important, so you are both informed and can both make safe decisions about your health. Is HPV infection serious? There are many types of HPV. The types that can lead to cervical cancer are called high-risk types. Other types, called low-risk types, may cause genital warts but do not cause cervical cancer. High-risk HPV is a problem only when it doesn't go away. If it stays in your body for a long time, it can lead to cervical cancer. Are there symptoms of HPV? No, HPV infection doesn't cause symptoms, so most people don't know they have it. A person can have HPV for a very long time before it's found. How does a person get HPV? HPV is spread from one person to another by skin-to-skin contact in the genital area. HPV can be spread even if there is no intercourse. HPV can be spread by vaginal, anal, and possibly oral sex. Are there any ways to avoid getting HPV? 4 things can reduce your risk for getting HPV. Get vaccinated. The HPV vaccine is safe and effective in preventing the majority of cervical cancers, precancer, and abnormal paps. It can also prevent the majority of genital warts. Avoid sexual contact. By abstaining from sexual intercourse and any skin-to-skin contact in the genital area, you can avoid getting HPV. Limit your sexual partners. Have sex with just one person, who has sex only with you. Use condoms. Condoms don't fully protect from HPV, but they can lower the chance you'll get it. Condoms also help prevent HIV, herpes, and other sexually transmitted infections. Please subscribe to our channel and give this video a thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.